Introduction. Inpatient mental health care, an overview.
Inpatient mental health care refers to the treatment of individuals with severe mental health conditions within a hospital or a dedicated mental health facility. This form of care is essential for individuals who require constant supervision, intensive treatment, or are a danger to themselves or others. Unlike outpatient care, where patients receive treatment while living at home, inpatient care involves living at the facility for the duration of treatment. This immersive environment allows for round-the-clock care, which is crucial for stabilizing patients experiencing acute psychiatric episodes. The importance of inpatient mental health care cannot be overstated. It provides a safe and structured environment where patients can receive comprehensive care from a multidisciplinary team, including psychiatrists, psychologists, nurses, social workers, and occupational therapists. These professionals work together to create individualized treatment plans that address the unique needs of each patient.
History and evolution. The beginnings of inpatient mental health care. The history of inpatient mental health care is a journey through various phases of understanding, stigmatization, and evolving treatment modalities.
In ancient times, mental illness was often misunderstood and attributed to supernatural forces. Those with mental health issues were frequently subjected to exorcisms or other religious rites. As understanding progressed, the need for dedicated care facilities became evident. The establishment of the first asylums in the 18th and 19th centuries marked a significant shift in the approach to mental health care. These institutions were designed to provide a haven for individuals with mental illnesses, although conditions were often harsh and treatments rudimentary. The infamous Bedlam in London, for example, became synonymous with chaotic and inhumane treatment.
Reform and modernization. The 20th century brought about significant reforms in the field of mental health care.
The advent of psychotropic medications in the 1950s revolutionized treatment, allowing many patients to manage their symptoms and lead more productive lives. This period also saw the rise of deinstitutionalization, a movement aimed at reducing the population of mental hospitals and integrating patients back into the community. While well-intentioned, deinstitutionalization often resulted in inadequate community-based support, leading to challenges in care continuity.
Current state and future directions.
Today, inpatient mental health care is guided by principles of human rights, evidence-based treatment, and patient-centered care.
Modern facilities are designed to be therapeutic environments that promote healing and recovery.
The focus has shifted from merely containing patients to actively engaging them in their treatment plans and empowering them with the skills needed for community reintegration.
Types of inpatient mental health care. Acute care units.
Acute care units are designed for individuals experiencing severe psychiatric crises that require immediate intervention. These units provide intensive treatment and stabilization for patients who are at risk of harming themselves or others. Treatment typically involves medication management, crisis intervention, and the development of a short-term care plan to address immediate needs.
Residential treatment centers.
Residential treatment centers, RTCs, offer a longer-term, structured environment for individuals with chronic mental health conditions. These facilities provide comprehensive treatment programs that include therapy, medication management, life skills training, and educational or vocational support. RTCs are particularly beneficial for individuals who have not responded well to outpatient treatment or require a more supportive environment to achieve stability.
Specialized inpatient units. Specialized inpatient units cater to specific populations or conditions. For example, there are units dedicated to the treatment of eating disorders, substance abuse, geriatric mental health, and child and adolescent psychiatry.
These units are staffed by professionals with expertise in the respective areas, ensuring that patients receive specialized care tailored to their unique needs.
Benefits of inpatient mental health care. Comprehensive assessment and diagnosis.
Inpatient settings allow for thorough assessment and diagnosis of mental health conditions. The multidisciplinary team can observe patients over an extended period, providing a more accurate diagnosis than might be possible in an outpatient setting. This comprehensive evaluation is crucial for developing effective treatment plans.
Intensive treatment and support. Inpatient care provides intensive treatment and support that is often not feasible in outpatient settings.
Patients have access to a wide range of therapeutic interventions, including individual therapy, group therapy, medication management, and recreational therapy.
The structured environment ensures that patients receive consistent care and support. Crisis intervention.
Inpatient facilities are equipped to handle psychiatric crises, providing immediate intervention to stabilize patients. This is particularly important for individuals who are suicidal, experiencing psychosis, or exhibiting dangerous behaviors.
The safe and controlled environment of an inpatient unit can prevent harm and provide a foundation for recovery. Skill development and rehabilitation.
Many inpatient programs focus on skill development and rehabilitation, helping patients acquire the skills needed for independent living. This includes social skills, coping strategies, and vocational training. These programs aim to empower patients to manage their conditions and lead fulfilling lives post-discharge.
Challenges of inpatient mental health care. Stigmatization and barriers to access.
Despite advances in mental health care, stigmatization remains a significant barrier to seeking treatment. Many individuals fear being labeled as crazy or weak and may avoid seeking inpatient care due to these societal attitudes. Additionally, access to inpatient care can be limited by factors such as cost, insurance coverage, and availability of beds.
Institutionalization and dependency. While inpatient care provides a structured environment, there is a risk of patients becoming overly dependent on the facility.
Prolonged stays can lead to institutionalization, where individuals struggle to adjust to life outside the facility. It is crucial for inpatient programs to incorporate discharge planning and community reintegration to mitigate this risk.
Resource constraints and staffing challenges.
Inpatient mental health facilities often face resource constraints and staffing challenges. High patient-to-staff ratios can limit the quality of care and increase the risk of burnout among healthcare professionals. Adequate funding and staffing are essential to ensure that facilities can provide the level of care required for effective treatment.
Balancing autonomy and safety. One of the primary challenges in inpatient mental health care is balancing patient autonomy with safety.
Patients have the right to participate in their treatment plans and make decisions about their care. However, in situations where patients are a danger to themselves or others, healthcare providers must intervene to ensure safety.
This delicate balance requires careful consideration and ethical decision-making. Treatment modalities in inpatient mental health care. Medication management. Medication management is a cornerstone of inpatient mental health care. Psychotropic medications can help stabilize mood, reduce psychotic symptoms, and alleviate anxiety or depression.
In an inpatient setting, healthcare providers can closely monitor the effects of medication, adjust dosages as needed, and manage side effects.
Psychotherapy. Psychotherapy, or talk therapy, is a critical component of inpatient mental health care.
Various forms of therapy, including cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and psychodynamic therapy, are used to address underlying issues and develop coping strategies. Group therapy sessions provide an opportunity for patients to share experiences and support one another.
Recreational therapy.
Recreational therapy involves using leisure activities to improve mental health and well-being. This can include art therapy, music therapy, sports, and other recreational activities. These therapies provide a creative outlet for expression, reduce stress, and promote social interaction.
Occupational therapy.
Occupational therapy focuses on helping patients develop the skills needed for daily living and employment. This can include vocational training, time management skills, and self-care techniques. Occupational therapists work with patients to create personalized goals and provide the support needed to achieve them.
Family therapy. Family therapy involves the patient's family in the treatment process.
This approach recognizes the importance of family dynamics in mental health and aims to improve communication, address conflicts, and strengthen support systems. Family therapy can help families better understand the patient's condition and develop strategies to support their recovery.
Patient experiences. The admission process.
The admission process for inpatient mental health care typically begins with an evaluation to determine the need for inpatient treatment. This may involve a referral from a healthcare provider, a crisis intervention team, or self-admission in some cases. The initial assessment includes a comprehensive evaluation of the patient's mental health status, medical history, and immediate needs.
Daily life in inpatient care. Daily life in an inpatient mental health facility is structured to provide stability and routine.
Patients participate in various therapeutic activities, including individual therapy, group therapy, and recreational activities.
There are designated times for meals, medication administration, and personal time. The structured environment helps create a sense of normalcy and predictability. Patient rights and advocacy.
Patients in inpatient mental health facilities have rights that must be respected, including the right to informed consent, confidentiality, and participation in their treatment plans.
Many facilities have patient advocates or ombudsmen who ensure that these rights are upheld and address any concerns or grievances. Discharge planning and follow-up care. Discharge planning is a critical component of inpatient mental health care.
The goal is to ensure a smooth transition from the inpatient setting to the community. This involves developing a discharge plan that includes follow-up appointments, medication management, and referrals to community resources.
Effective discharge planning reduces the risk of relapse and promotes long-term recovery. Case studies. Case study 1, treatment of acute psychosis.
A 28-year-old male presents with acute psychosis, characterized by hallucinations, delusions, and severe disorganization.
He is admitted to an acute care unit, where he receives antipsychotic medication and participates in individual and group therapy. Over the course of several weeks, his symptoms stabilize, and he begins to engage in recreational and occupational therapy. Upon discharge, he is referred to an outpatient clinic for continued support and medication management. Case study 2, managing severe depression.
A 45-year-old female with a history of severe depression is admitted to a residential treatment center after multiple suicide attempts.
She receives intensive psychotherapy, including cognitive behavioral therapy and dialectical behavior therapy.
The structured environment and supportive staff help her develop coping strategies and build a support network. After several months, she is discharged with a comprehensive aftercare plan, including regular therapy sessions and support group participation.
Case study 3, adolescent inpatient care.
A 16-year-old female with an eating disorder is admitted to a specialized inpatient unit.
Her treatment includes medical stabilization, nutritional counseling, and family therapy. The multidisciplinary team works closely with her family to address underlying issues and promote a healthy relationship with food. After several months of treatment, she is discharged with a plan for continued outpatient therapy and support from her school. Future directions. Integration of technology.
The integration of technology in inpatient mental health care is a promising development. Telepsychiatry, virtual reality therapy, and mobile health applications are being explored as tools to enhance treatment and improve patient outcomes. These technologies can provide additional support, increase access to care, and offer innovative therapeutic options.
Emphasis on holistic care. There is a growing emphasis on holistic care in inpatient mental health settings.
This approach recognizes the interconnectedness of physical, mental, and emotional health. Holistic care includes not only traditional therapeutic interventions but also complementary therapies such as mindfulness, yoga, and nutritional counseling.
Patient-centered care models.
Patient-centered care models prioritize the preferences, needs, and values of patients. This approach involves patients in the decision-making process and tailors treatment plans to their individual needs. Patient-centered care fosters a sense of empowerment and ownership over the recovery process. Addressing social determinants of health.
Future directions in inpatient mental health care also include addressing social determinants of health, such as housing, education, and socioeconomic status. These factors significantly impact mental health outcomes, and addressing them can lead to more comprehensive and effective treatment. Conclusion. Inpatient mental health care is a critical component of the mental health care continuum.
It provides intensive, comprehensive treatment for individuals with severe mental health conditions, offering a safe and structured environment for stabilization and recovery. While there are challenges, including stigmatization, resource constraints, and the balance between autonomy and safety, the benefits of inpatient care are substantial. Through continuous evolution and adaptation, inpatient mental health care can meet the needs of diverse populations, providing the foundation for long-term recovery and improved quality of life. By integrating technology, emphasizing holistic and patient-centered care, and addressing social determinants of health, the future of inpatient mental health care holds promise for even greater advancements in treatment and patient outcomes. This comprehensive overview highlights the importance, complexities, and potential of inpatient mental health care. It underscores the need for ongoing investment, innovation, and collaboration to ensure that individuals with severe mental health conditions receive the care and support they need to thrive. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.